Hi everybody, my name is Anne-Marie Milliken. I'm the head of safeguarding for Priory. Priory is a national organisation that supports people with a range of needs, both healthcare and adult care. And within our healthcare division, we also support children and young people. So today my presentation focuses on Priory's response to improving safeguarding by the investment in training. And I'll just take you through what we have done to rejig our training. So when did the conversation begin? I joined Priory in May 2002, and my colleague Amanda Smith, who's the named nurse for safeguarding children, looked after children in transitions, joined just slightly before me in February 2020. So with the new staff joining at that senior level, it does provide an opportunity to ask questions, to see things differently, and as they say, have that fresh eyes on something. So the conversation began with Amanda and I starting and saying, what do we do? Why do we do it? Together we did see opportunities, and there was loads of scope for change and development. And one of the important things to remember is when we're looking at anything that we do is don't wait for the opportunity, create it. Ask the questions when you think of the question. If you're waiting for 3 months' time for, say, the committee or something to happen, by that time you've moved on, you've forgotten about it. So when you're looking at change, when you're looking at an opportunity, grasp it if you can. Every year, Priory undertake an annual safeguarding audit. I'm sure many of the other organisations within this call will do something very similar. And it's a 3-layered audit. We focus on safeguarding leads. Every service that we have has a designated safeguarding lead, usually the HD, the service manager, or someone within a similar senior post. All colleagues will have an opportunity, and service users and patients. So all 3 of these different audits come together to then give us that operational direction of where we're heading. It takes place between June and July, and much to the horror of the staff when I developed this audit, was that I added a significant amount of questions, because it's what was their baseline wasn't my baseline. I knew nothing of Priory, so I had to get a lot more information to then develop pathways for that directional working. But what came through is that Priory colleagues attend safeguarding training every year, and it had actually turned to be a tick box exercise. So they were turning up, but actually were they gaining anything from it? So we were meeting compliance, but are we benefiting our staff? Are we actually benefiting those within our care? Or is the way that we're doing things causing more harm than good? Because if you're turning up to training and not engaging, not listening, then actually what's happening with that? And therefore, are you taking anything away with you that day? So all these questions were asked, and we then thought we have to change, we have to do something different. More about the safeguarding audit. Another thing that came through is that when people were asked about the senior leadership team, specifically for safeguarding, they couldn't identify the who was who. We were getting loads of different people, and actually the majority of staff really struggled with naming me as the head of safeguarding, Amanda as the named nurse, the named doctors, their regional leads. So all of the really important roles that are there to support and help and be there for advice and guidance, nobody could identify them. And we then challenged ourselves, do we do something about this? Or do we actually say, let's change, but let's change both of these things at the same time? If you don't know your leadership, are you less likely to reach out and ask questions? And that was our worry, is that if we're not visible enough, will people raise things to us? Because if they don't know who we are, then they can't raise things to us. So we said, it's not good enough and we need to change. And it went from us down at the kind of operational level and that kind of strategic level, all the way up to the board, that it was an agreement that things must change. So when you look at a journey and you think, when did it actually start? Did it start with Amanda arriving in February 2022, me in May 2022, or did it actually happen before that? So although Amanda and I saw the opportunities, Priory has a constant change and development focus, and therefore it's never stagnant, and it's never been stagnant since before I started. Close to 3 years now, Priory invested really heavily in learning development, and an actual safeguarding regional learning partners team was created. So this was the first major step for safeguarding in Priory, with dedicated trainers to do that level 3, that combined safeguarding training. So the regional learning partners cover the whole of the UK. They offer virtual, they offer face-to-face training, and the team support the whole of the organisation, but primarily adult care and healthcare at that moment in time when they did get created. It was a small team of dedicated trainers. Since Amanda and I have started, it has done nothing but grow arms and legs. And my bit going on a bit will show you what those arms and legs are. But from something small, it's been able to grow something into something spectacular. But it's that investment into saying we need this resource that we're able to then move forward. So I created a training proposal that looked at the whole of the organisation, being a new starter, learning the systems and the way that the organisation operates. I was in a very privileged position to have that time and that energy to step back and look at all the nuances that we have within any organisation. I asked myself, are we doing it right? Is it fit for purpose, and what needs to change? That then was brought into a proposal paper that was presented to Priory Board. At the same time that this was happening, we had the unfortunate passing of both Star and Arthur. And what we had the opportunity to say is no death of a child goes unnoticed. And this was a national thing that happened, with the report being really well publicised. And so Priory took time to consider this report. It took time to consider all of the recommendations that it happened. Star and Arthur had nothing to do with Priory. They were no way connected to it. But we said, what can we learn from these deaths? What can we learn from that report and take it back into our organisation? So we again asked ourselves, is there anything we can do better? And is there any learning that we need to take forward? And there absolutely was. Star and Arthur will forever have a mark on Priory, because it's the report that really went into my proposal paper and says this is why we need to change. It's not just me being a new worker, it's not just me being a new head of safeguarding, but it's the why we have to do something and we have to reach that gold standard. So the proposal paper gave loads of options. One always being let's do nothing, and it moved on to changing the way that we actually facilitate training, and it worked around the regional safeguarding partners. So as I've said before, originally in Priory, all staff who needed level 3 training did that level 3 training every single year. We couldn't change without capacity. So one main focus of the board report was that we have to stop doing this annual training. It fills up the regional learning partners. It creates a blockage to actually diversifying our training, and we needed that capacity to advance, to learn, to develop. You need to understand what your capacity is, because if you don't have capacity, you might have the want to change, but it's very difficult to create the time to change. Creating and putting something out that's new is time consuming. Many of us will work with project managers that say it's a big change is really impactful and you need the time to allow that. So it's having the understanding that we had to create that capacity. And my proposal went to the board to say that we have to stop doing the 3-yearly training, well, the yearly training, move it to once in a 3-year cycle, so the level 3 training in a 3-year cycle, to then allow us to develop other trainings. So it's not a move it to 3-yearly and do nothing. It's actually, we're going to fill the people's time, we're going to fill our colleagues' time, but we're going to be really specific in what we fill it with. We're not just going to be generalising level 3 course, we're going to be really specific and give them really dedicated information. So in October 2022, it went to the board and the board agreed for the compliance training to move to a 3-yearly cycle. And that was showing the connection between what we do operationally and actually Priory as a whole. These big decisions is not something that I hold, it's something that Priory board hold to ensure that there is that interrogation of what we do and why we do it. And the first thing that we did is development started to, we then created a domestic abuse training package. So the timeline for what we did, so as I said, October 2022, the agreement went to the board for change. It was confirmed that time. And in January 2023, so just this year, we took away year 2 and 3 refreshers because it was a regurgitation of everything that we'd talked about and nobody was getting anything new. Nobody was excited about safeguarding. And January at the same time, we started developing domestic abuse training. The reason we chose domestic abuse training, it was a very clear feature in the Star and Arthur report. And it was staff not feeling confident to say and see domestic abuse, not knowing how it impacts, not knowing the impact on children, how it impacts on dynamics and relationships. So there's lots of things regarding domestic abuse that says we need to learn more about this and we need to skill our staff to learn more about this. May 2023, it goes live, and initially it was 1 course per month. Swiftly, it turned into 2 courses, and 90% of the time these courses are fully booked. So 20 people every course, absolutely. So by the end of the year, we will have had over 100 people go through this domestic abuse course. And June 2023, we started the development of advanced safeguarding. I'm not going to go into that because that's a different presentation, but it's that we're not standing still. We're absolutely seeking to achieve gold standard and we're always on a continuous learning journey. On October 2023, so just recently, our advanced safeguarding went live, and that's colleagues linking into that assurance and accountability and leadership. So in January 2023, the head of safeguarding, so myself, has facilitated lunch and learn sessions. So like we said, we're not stagnating. We're going to fill people's time, and it's not just once every 3 years on safeguarding is enough. It's not enough. We want to make sure that we're giving people opportunity to learn, to develop, to gain interest in safeguarding, and realise what a special topic it is to talk about. So once a month we had speakers both internally and externally. A shout out to Saved Lives, who really took on board what we were asking, and they participated in this as well. At a minimum, every month, 60 colleagues were taking part in these calls, and I've just listed some of the topics that we explored: adultification and transitional safeguarding, domestic abuse, not only domestic abuse, but actually how to go through that DASH risk assessment, coaching people through using it. Apologies. Infection prevention and control, cybersecurity. Only yesterday, we had a specific session for medical colleagues. So this was open to everybody. And it was absolutely the communication to get out. So from January to now, we've really learned how to get people involved in this, how to cascade information. Because initially that was one of the blockages. We were saying we're putting these things on, but we're not getting people from this area or that area. Why is it the wellbeing centres don't know about it? So we had to learn how to cascade. We had to learn how to get people just aware that these sessions were open sessions and that their time going on to these were protected times. So that if you did join one of these sessions, put down your emails, put down your phones, have it on in the background so that everybody could be part of this. And as you can see, diversity of what we were going through was that it was diverse. Not only did we do the lunch and learns, we also focused on 7-minute briefings. So alongside the lunch and learns, we developed a 12-month programme of 7-minute briefings. We did flex the 7-minute briefings so that if something was coming through in terms of a learning, either from Priory or nationally, we then changed the 7-minute to meet that so that we were responsive to what was currently in conversation. And here is the amazing thing for the 7-minute briefings. You'll see the numbers at the side. This is the amount of times in Academy somebody has read it. So when we look at county lines, there's 1,179 individuals within Priory who have read this. Self-neglect were 1,522, and for making safeguarding personal, we're over 2,000 individuals. All of these numbers are individual people. And thus far, we're over 10,500 people have accessed the 7-minute briefings. So think of the learning, think of the engagement. None of these things are mandatory. The compliance is rated on that 3-year cycle. So everything in between is that engagement with people to say, let's be excited about safeguarding and let's actually engage in the conversation. And people have shown that willingness and that want to engage in the conversation. So as I've said previously, we did develop a whole domestic abuse training. This is a whole day worth of training. It went live in May 2023, and it is open to every single member of Priory, regardless of where you work, whether that's adult care, healthcare, central services, whether you're a hospital director or a maintenance individual. It doesn't matter your post. We very much go with the ethos that for domestic abuse, it's non-discriminatory. And so the focus of the training actually takes you through supporting service users, but equally supporting colleagues, because anybody can be impacted by domestic abuse. And the focus really within that training, again, was touching on children and them no longer just being part of the situation, just being witnesses, but actually being victims in their own right, and supporting colleagues to understand that, and then supporting them to not only understand, but then having to manage that and respond to that. So colleagues have reported that they feel better prepared in noticing the signs of domestic abuse. They report that they feel more confident in speaking to service users, and therefore can we then say that our service users are more safer, because if our staff are confident and capable, they then can ask the questions. If we think about that, make every contact count, our staff are now gearing up to make every contact count, to ask the questions, and allowing our service users, our patients, to respond if they're ready to respond. Until May to November, over 100 Priory colleagues have gone through this course. And some of you may work in Wales, some of you may not. In Wales, there's legislation for domestic abuse, and it's a gold standard within Wales to make it mandatory. And so Priory have followed that gold standard to say within our Welsh services, we will align ourselves to the legislation, and all Priory colleagues within Wales will have to go through this training. So we're not only saying what we have is a minimum standard, we're working towards the legislation and constantly working towards that gold standard to make sure that we are achieving the best for our service users. Has there been an impact? One of the things is, when you have a big change, you have to understand what the impact has been, if any. So as I've just said, staff are feeling more confident. They are reporting their confidence is building, their knowledge is building, they're getting interested in safeguarding, and they realise that it's not all doom and gloom. The uptake has been high. Other than for Wales, these are all non-mandatory courses. The leadership within our services, both adult care and healthcare, are the ones pushing it to ensure that it doesn't fall off the radar and that all staff are aware of these things. Originally, we started at you self-sign these courses, but when we realised that people were struggling with that, we trained and supported our SLAs, as we call them within Priory, to coach and guide staff on on the ground as well, and assign people who had gone through that training on their behalf. We updated Datex because one of the things we have to understand is, are we actually improving the lives and the safety of our service users? So we updated Datex to ensure that we could evidence that we were asking our service users what their wishes were, what their outcomes were, what their felt risk was. So now within Priory, we're able to report on, if an incident happens, how at risk did the service user feel at the start of the journey, and then we're able to review it at the end of the journey and then compare that. So in October, 10 service users said that they felt at the most highest risk. They felt really unsafe. When that process had gone through the process and it was re-rated, nobody felt at high risk, and therefore we can then conclude that our impact, our interventions have been successful in reducing that felt risk. So it's understanding not only colleagues' perspective, but equally that service user perspective, and looking at the impact of what we do, and constantly bringing that back to any changes that are needed. So this is a positive indicator that we are going in the right direction, that we are doing the right things. So what is next for Priory? The development of training does not stop, and it will never stop. The lunch and learn sessions will continue, and there's a programme going into mid next year with already organised events. And there's a 12-month programme for the 7-minute briefings. Again, all these can flex, they can change depending on what's occurring at that moment in time. So for one of the things we're going to develop next year is a lunch and learn on physical health, for example. That's a big thing for an organisation that focuses on mental health, because sometimes physical health can be forgotten, can be missed, can be a second thought. And so bringing it into a normalised conversation means that people will be more considerate towards physical health. The Safeguarding Regional Learning Partners, alongside the Safeguarding Senior Leadership Team, will move to commence a number of training courses, and they're going to develop these training courses. We're looking at adverse childhood experiences and how having experience in childhood actually impact on adult safeguarding. Prevent beyond the basics. So we're wanting to talk about prevent more. We're wanting to talk about radicalisation and terrorism, and actually have that as a conversation, and what is our prevent duty. And with all the training courses that we are going to put on, and we have put on, we're going to be building up a quality assurance system to ensure that they remain of a quality standard, that they are meeting our expectations, and they are consistently of a quality training course. And as I touch on what we spoke about at the start, that the senior leadership team weren't known about. So the head of safeguarding facilitates all lunch and learns, so that for anybody who joins these sessions, the first thing they see is my face. They'll see Amanda on the calls, they'll see other people on the call that are part of that senior leadership team. One of the things we're also bringing, so for the level 3 course that's on the 3-year cycle, they have videos from the exec lead for safeguarding, the head of safeguarding, and other individuals from the leadership team. So again, it's saying the visibility of the leadership team is there, because everyone will go on that level 3 training. I'm wanting to finish up my presentation to explore a little bit of culture with you, because culture is how we look at, are we doing the right thing or not? And so Priory is a learning organisation. We are constantly evolving. We learn from incidents that are internal incidents, external incidents, and as I said, the unfortunate death of Arthur and Star has nothing but been impactful for Priory. We take every learning opportunity that we can. So Priory are proud to be an organisation that is inclusive and really within safeguarding. And so this is a shout out to Sabrina Pals. She's a newly qualified social worker who decided to stand up and say, I've got an idea. And it was utilising the see something, hear something, say something. And Sabrina suggested that within her service, within Priory, that we implement safeguarding cards to be given out to visitors. Sabrina started to develop that idea, and with support created safeguarding cards that went to trial within her service at Sutton's Manor. These then went to her region for trial in that bigger scale, and on Monday at the start of Safeguarding Week, I can happily say that safeguarding cards are now the whole part of Priory, so that it's our job to ask visitors, be that family, be that a relative, friends, contractor, professional, everybody will be given a card that says, if you have any concerns, please tell us and we will support that, we will look into that. So it's the onus is on us to give out the cards rather than people to pick up a card. And so it's within Safeguarding Within Priory, it's any idea, but any person can have that idea and we look at it. It's Priory isn't a top down, it's an anybody can work towards that improvement, can work towards that gold standard, and it's not dismissing those ideas. It's really saying that if you want to say something, if you want to be part of that improvement, be part of that improvement, because everyone is listened to. And that's a real indicator to culture. One person with a negative culture can really spread out and cause a ripple effect by really moving towards that positivity, that growth, that improvement. Lots of people do get on board with that, and it's been a fantastic journey that we've had in the last 18 months, because so many people are creating suggestions for training, so many people are wanting to be part of the Lunch and Learns. There was a period of time where I focused on talking about Datex a couple of months, and I was getting email after email on a daily basis. Why are we not having the Lunch and Learns? And I'm like, we're just doing it slightly differently. So staff want this, and sort of Priory staff have really ran with it. And you can see the numbers that we're able to target so many people and really get to grips in what safeguarding is and keep it a live conversation. Just so people can see what the safeguarding cards look like, really simple. They sit at receptions or sign-in books, and it's if you see something, tell us. Service user safety and protection from harm is our priority, and then every service is able to go into these cards and adapt to their own service, the name of the safeguarding lead, the name of the site, email, telephone numbers, it's all there for the services to utilise. And as I say, that went out this week as a support for Safeguarding Week. So thank you very much for listening to my presentation. Happy for any questions. I probably whistled through this.
Anne-Marie, thank you so much for that. You're getting lots of thumbs up and claps and hearts and everything from the chat. Someone called Jennifer has asked about the costs of the transformation project, and whilst I imagine there may be a degree of commercial sensitivity there.
So it's actually one of the easiest things to say is because we created capacity, the cost was already sucked up there, because by creating capacity in what was already an existing team, there was no additional cost. When we go out and ask for people to come and speak to us, we are we're wanting people to help us to energize the conversation. So I gave a shout out to Saved Lives. They were able to do that free of charge, and really support not only what they do, but what we do as well. So it's working in partnership with lots of people, and utilising the people that we have internally within Priory. The experts that we have are often consumed within their own services, but bringing that back to say, can you then tell everybody about what you do? And we think of the forensic services in particular, they can be a wee niche about that public protection. Come to my forum and talk about public protection. So it's the cost was, there was no cost because it was there already.
That's fantastic, thank you. And it's lots of comments about the cards, and it's really great to hear about the cards. And I know that we've got something similar being designed at the moment, and it's a bit like that convergent evolution thing where different providers have similar things going on without necessarily...
I'm just going to say that Phil stole my idea, or well, Sabrina's idea.
Oh no, Sabrina, it was a fantastic idea, and it's lovely to hear that it's happening elsewhere as well. It's really exciting to hear about everything going on.
Yeah, and most importantly, Phil, for me, that's why I put it in today's speech. It's a newly qualified social worker that stood up and said that, and that's really important. Everyone must be allowed an opportunity to say an idea.
Definitely, definitely. And it's been fantastic to hear about the mixture of topics, the 7-minute briefings, refreshing and reinvigorating the learning materials. I imagine the regional learning partners are excited about the opportunity to have some diversity in what they deliver. And that's one of the benefits, isn't it, of having your own trainers? It means you could rapidly embed learning into your training. And something I imagine a lot of colleagues, attendees today will be taking note of is the use of so you described it as Academy, but it's the learning management software
Mhm.
to track the readership of things like briefings and 7-minute briefings and stuff. And I imagine there'll be lots of people making a note of that, definitely. So thank you for sharing that
Everything
as
that we
well.
do within our safeguarding learning goes on to Academy, and it's not only so that we can track it, but it's so that people can then say, "I've got evidence that I attended." So it's come to my learning session, and you can use that for your revalidation. Doctors use it for their GMC validation. Social workers will absolutely be using it this November. So it's not just turn up, but actually it's evidence that you are engaging.
That's brilliant. Thank you so much. So thank you, Anne-Marie, and I'm sure you'll kind of hang around and answer any other questions which have come up in the chat. So thank you for that.